Good afternoon. Hello everyone. I'm here to show you the basic instruments which are found in a general minor instrument pack, okay, or a general minor instrument tray. So this is not basically a complete pack, but more or less we have only few which are not here. Okay, so I'm just going to show you the instruments, basic instruments that are here. And you already have, I assume you have already studied the functions, the purposes of these instruments. You're supposed to orient yourselves before you expose yourselves in the operating room for your major surgeries, or even in minor surgeries. You use this one also. So let's start. Our instruments here, we have these basic instruments which are available here in our simulation room. Let's see what we got. So we have here the one that is curve. Okay, this one. This is a little. These instruments here are clamps, no? Curved clamps, but these are small clamps, small curved clamps. These are being used for minor surgery. Okay, and these are called mosquito. Okay, so the mosquitoes are being used. Mosquito are being used to clamp. Okay, to clamp blood vessels when you're going to cut the skin, and you are supposed to use this one to clamp blood vessels. Okay, so these are your mosquito. And then we also have here the bigger clamps. Okay, the bigger ones, these are called Kelly clamp. Okay, bigger than the mosquito. Okay, these are called the Kelly clamps. It's just the same, and the same purpose is going to clamp any blood vessels. Okay, when you cut a skin, a tissue, you have to, when you need to clamp a blood vessel, then you can use this one. Okay, so that's it. That is the Kelly clamp. We also have in our set the Alice. Okay, the Alice are also clamps, but unlike the mosquito, the Kelly clamp, the Alice has teeth here. Okay, so this is about 4. Okay, you see that? Okay, it's also a clamp. Okay, but this is atraumatic, meaning it doesn't tear any blood vessels, no? It's just going to clamp like that, but because it's blunt, okay, it is atraumatic. Okay, and then we also have, of course, you have used this one already in your suturing. Okay, this is what? This is a suture forceps. Okay, that we used to put on our sutures. Okay, it has teeth in here. It's blunt, and you clip that one on, then that will be used as our suture forceps. We also have here This one is our Mayo scissor. When do we use the Mayo scissor? Mayo scissors are also used when you are going to cut, and this is usually being asked, by the chief surgeons to cut a suture. Okay, they're going to cut a suture. You're just going to anticipate, give the Mayo scissor. And we also have another scissor here. This one it's a Metzenbaum. Okay, Metz. Okay, a more sharper tip here, but it's used to cut also. But usually, what is being asked, to cut for, what is being given to our surgeons to cut for some sutures, it's usually the Mayo scissor. Okay, that's it. We also have our tissue forceps. Now, you have used this one in your dissection, I believe so. This one is an Adson's tissue forceps. It's flat. Okay, it's used to get a tissue before you do your suturing. This one also is called as the rat tooth tissue forceps. It has tooth here, okay, on both sides. It's going to clip a tissue before you do your suturing. So basically, these are what we do not have in here in this set are the towel clips. The towel clips also looks like your mosquito, but they are sharper. Okay, it has two sharper teeth that is used to connect two towels together in place like that. Okay, when you prepare the operation site. Okay, so we do not have the towel clips, but you have it there in your notes that I sent you. We also do not have, of course, the pack should be complete with forceps, the retractors. We have Murphy's retractors, we have Sen retractors, and we have Richardson's retractors. So it's used to retract both tissues together to open a site, okay, or a field. So these are basically the instruments that are being prepared in your general minor instrument tray. So the question is, how are you going to, if you are the assisting surgeon, how are you going to give to your chief surgeon these instruments? So there are hand signals that I've given you. When sometimes you just have to anticipate what is needed, okay, and then you just have to be able to read between the lines, just have to understand the hand gestures. So when the chief surgeon will say like that, it's usually the scissor that they need. That is anticipated because, especially if they had just closed or you had just closed the tissue, okay, in suturing. So when they asked for that one, that is sutures, the scissor, okay. And then if they would ask for this one, these are usually the tissue forceps, okay. So these are the things that the hand signals that they use in the operating room. And then how are we going to give to our chief surgeon the instruments. The chief surgeon will just do like that, meaning, or if he's asking for a scissor, then they have to do like that. What we're going to do is to make them feel that you are already giving them the instrument. So what are we going to do? How are we going to give it? In this way, and then make sure that you are giving them firmly the instrument. So it's going to be like that, and then you give it like that. Okay, so that would make that would inhibit, not inhibit, but that would let the surgeon do his reflex. No, when you let them to give them firmly, the reflex is to get it. Okay, so like that. See? Okay, so that's how we are going to give the instruments. You make sure that when you are going to give an instrument which is sharp, how are you going to give it? Your sharp instruments should be facing the midline of the surgeon. Okay, so you have the sharp instrument here. Okay, have the sharp instrument there, you give it like that, but it's facing midline. Okay, like that. Okay, so if this one, you give this one, do it like that. It should be in between what? The thumb and the middle finger. Okay, like that. So if I am the surgeon, you give it like that. Okay, it should be facing the midline of the surgeon. Okay. So that's it. Basically, those are the basic instrumentation. The instruments that you may find in the minor instrument tray. It could also be found in the major operation tray, no, or package. Except for, of course, for major operations, you have to have retractors, the Sen retractors or the Richardson's retractors, where you should have two, and the rest are just going to be added in the sterile field, like your gauze bandage, and it should always be counted. Whatever it is that you have received, how many or the number of instruments that you have received should be the same instruments that you will be counting right after the operation.